Which structure in the male reproductive system contributes the largest volume to semen? Correct answer is option B, seminal vesicle. The hormone responsible for stimulating Leydig cells in males is. Correct answer is option C, LH, luteinizing hormone. In females, which layer of the uterus is shed during menstruation? Correct answer is option C, endometrium. The blood-testis barrier is formed by. Correct answer is option B, Sertoli cells. Which of the following hormones surge just before ovulation? Correct answer is option D, LH, luteinizing hormone. Which part of the sperm contains enzymes necessary for penetrating the egg? Correct answer is option B, acrosome. Which artery primarily supplies blood to the uterus? Correct answer is option B, uterine artery. Which hormone prevents degeneration of the corpus luteum in early pregnancy? Correct answer is option C, HCG. The structure that connects the ovaries to the uterus is. Correct answer is option D, ovarian ligament. The first meiotic division in oogenesis results in. Correct answer is option B, one secondary oocyte and one polar body. Which hormone inhibits FSH production in males? Correct answer is option C. During the luteal phase, which hormone predominates in females? Correct answer is option B, progesterone. The positive feedback loop of estrogen causes a surge in. Correct answer is option C, LH, luteinizing hormone. Which hormone is responsible for milk ejection? Correct answer is option B, oxytocin. Prolactin is primarily inhibited by which hypothalamic hormone? Correct answer is option B, dopamine. Which hormone is secreted by the placenta to maintain pregnancy? Correct answer is option D, progesterone. Which hormone initiates spermatogenesis? Correct answer is option B, FSH. Which gland secretes GnRH? Correct answer is option D, hypothalamus. Corpus luteum produce. Correct answer is option C, progesterone. In females, the peak of estrogen just before ovulation leads to. Correct answer is option B, LH surge. Fertilization usually occurs in. Correct answer is option D, ampulla. The outer layer of the blastocyst that contributes to placenta is. Correct answer is option B, trophoblast. Implantation of the embryo typically occurs in. Correct answer is option B, endometrial lining. The hormone tested in pregnancy test is. Correct answer is option C, HCG. Which structure forms the maternal part of the placenta? Correct answer is option B. The primitive stage in embryology gives rise to. Correct answer is option C. Germ layers. Which germ layer give rise to the reproductive organs? Correct answer is option B. Mesoderm. Capacitation of sperm occurs in. Correct answer is option C. Female reproductive tract. Which part of the placenta is fetal in origin? Correct answer is option A. Chorionic villi. The embryonic precursor of the male reproductive tract is. Correct answer is option B. Wolffian duct. A condition where the testis fails to descend into the scrotum is called. Correct answer is option B. Polycystic ovary syndrome is primarily characterized by. Correct answer is option C. Hyperandrogenism. Endometriosis is defined as. Correct answer is option B. Presence of endometrial tissue outside the uterus. Benign enlargement of the prostate in aging males is termed as. Correct answer is option C. Testicular torsion primarily affect. Correct answer is option A. Blood supply to the testes, which is a common cause of infertility in women with regular cycles. Correct answer is option B. Tubal blockage. Which cancer is strongly associated with HPV infection? Correct answer is option C. Cervical cancer. Klinefelter syndrome is genetically characterized by. Correct answer is option C. 47XXY. A female newborn with ambiguous genitalia is likely to have. Correct answer is option B. Congenital adrenal hyperplasia. Turner syndrome is associated with which of the following karyotypes? Correct answer is option C. 45XO. Which of the following contraceptive methods works by inhibiting ovulation? Correct answer is option B. Oral contraceptive pills. The surgical procedure to cut and tie fallopian tubes is called. Correct answer is option C. Tubal ligation. A pap smear is used to detect. Correct answer is option B. Cervical dysplasia. Which diagnostic tool is most useful for evaluating uterine and ovarian structures? Correct answer is option C. Ultrasound. The APGAR score of a newborn assess all except. Correct answer is option C. Blood sugar. Which of the following is a barrier contraceptive? Correct answer is option B. Diaphragm. Ozoospermia refers to. Correct answer is option B. Absence of sperm in semen. Which fetal membrane directly surrounds the fetus and contains amniotic fluid? Correct answer is option C. Which is the most fertile period in a regular 28 days menstrual cycle? Correct answer is option C, day 12 to 16. Which maternal antibody can cross the placenta to protect the fetus? Correct answer is option D,